Welcome to today's program, A Good Night's Sleep. I'm Cindy Miller, and I'm a community navigator with the KU Alzheimer's Disease Center Cognitive Care Network. A good night's sleep is so critical to our physical and mental health. However, many individuals experience some very common sleep problems. In fact, it's not unusual as we age to have difficulty sleeping. We also know that about 25% of individuals with a dementia do have sleep challenges. So it's very common for individuals like yourself to have difficulty. You may have difficulty in falling and staying asleep. Perhaps you wake up frequently during the night, or you may be waking up much earlier than you did historically, more than what is normal for you. Now, what I know is that each of us have those nights where we may be restless and don't sleep as well. But overall, having a good, consistent night's sleep is really important. So, there are some factors that contribute to having poor sleep. You may have mental and physical exhaustion at the end of the day. There are also changes in your brain that are affecting that sleep awake cycle that we all have. Of course, again, as we age, we will experience having a need for less sleep. That's not uncommon. For example, a teenager may require up to 12 hours of sleep a night, where an older adult may require only 6 to 7 hours. Perhaps you are sleeping excessively during the day. Maybe there's a lack of motivation in terms of what you should be doing. Maybe um, you don't always have that structure in place where you know what the next thing is you could be doing. So you're sleeping more. Certainly, taking caffeine through like pop or coffee at bedtime, alcohol, and nicotine could contribute to your poor sleep. There's also various TV and internet programs that you may be watching before bed that certainly are contraindicated to having a good night's sleep. There's also some medical conditions that may be contributing to you just not being able to sleep as well as you used to. Perhaps you need to be evaluated for depression. You know, depression can make us sad, uh, unmotivated, make us be more recluse, um, make us more sleepy during daytime, not being able to sleep at night. There's another condition called restless leg syndrome where your legs may move. It becomes uncomfortable. You can't really stop them. There's a medical condition called obstructive sleep apnea, where during your sleep time, you may stop breathing briefly and then start breathing again. And that's going to prevent you from having a sound sleep. Maybe you're a person that has some untreated pain or just generalized discomfort. Perhaps you have a chronic condition such as arthritis or osteoporosis, or some long term condition where you just have discomfort. For our bodies to relax, we have to make sure that we aren't experiencing that discomfort or pain while we sleep. And then there are some medications that have side effects, that instead of just helping you sleep, they may cause you to be more hyperactive at night. So, what can you do about it? First of all, you may need to establish a routine during the day, build in more structure for when you have your meals, when you're going to be getting up in the morning, and your bedtime. Uh, have that consistent schedule. I know even for myself, if I go to bed at the same time and get up at the same time, I just feel more uh, better and more wide awake. Another suggestion is to avoid the use of caffeine, alcohol, and nicotine, which you would get from certainly tobacco, smoking. They recommend at least 4 hours prior to bedtime. Get some daily physical activity with sunshine when it's possible. That helps our sleep wake cycle, and daily activity does contribute to a good night's sleep. It's also important to have 1 to 2 hours daily of social activity. Perhaps go out for coffee with friends, maybe sit on your front porch or on your driveway and visit with people walking by. Stand at your fence if you have one and talk to your neighbor. It doesn't necessarily have to be anything formal schedule, but just socialize with those people in your circle. I know with COVID the last year, it was more difficult to socialize with others, but now that things are opening up, we can do more of that. And certainly limit your daytime sleep. If you do get sleepy during the day, perhaps taking just a 30 to 60-minute nap in the afternoon might help you get through the day, but not hinder good sleep at night. Other things you can do is avoid those TV and internet programs that will affect you negatively. Maybe they're programs that have violence or traumatic events. I know personally, if I watch a program like that before bed, I can't seem to let go of it and I don't rest well. So, really look at those programs that you're watching, make sure that they bring joy to you and are positive and relaxing and not a negative for you. It's also important to keep the bedroom only for sleeping and intimacy. Don't have the TV and radio on when you're going to be going to bed. Keep the bedroom as quiet as possible with just a low level light or that lighting that you need to get up, perhaps to use the restroom. Um, there's also low level white noise that can help decrease the outside noise and to keep the noise level the same in the bedroom. You can invest in a white noise machine that you would have at your bedside. And then try to maintain a cool but uh, comfortable temperature in your room. That will also contribute to good night's sleep. I think you're probably finding all of these tips are good for all of us. So another suggestion is, talk with your physician. Do a medication review with them to see if there's any medications you're taking that may have possible side effects that are affecting your good night's sleep. Also, talk to your physician about medication management of any chronic pain or discomfort that you may be having that's keeping you from going to sleep and staying asleep. You may need an assessment and treatment for depression. I would encourage you, if you are feeling some of those symptoms I mentioned earlier, to talk to the physician. Unfortunately, sometimes depression has a stigma attached to it in some circles of individuals. However, depression is a condition that can be treated. So if needed. So again, talk to your physician. You'll also want to talk to your physician about having the benefits of having a sleep study done, to see if you are having some breathing issues when you're in bed. And then talk to a physician about treatment for symptoms of if you have that restless leg syndrome. So that kind of quickly summarized what you can do, some steps you can take if you're having sleepless nights or restless nights. I thank you for attending this program. And if you have any questions, please don't hesitate to reach out. My name is Cindy, and I work for the Cognitive Care Network at the KU Alzheimer's Disease Center. My contact information is there, and please don't hesitate to reach out with questions, or if you want to discuss this further, you can feel free to contact me or any of my colleagues. Thank you.